Hello, my name is Ellisiv Bogeberg, and I would like to thank the organizers of the ESO conference for this opportunity to present the results from the TWIST trial. The aim of the trial was to determine whether thrombolytic treatment with Tenecteplase results in better functional outcome compared to standard treatment with no thrombolysis in patients with acute ischemic stroke and where non-contrast CT was used for screening of patients. The trial was designed as a prospective randomized open trial with blinded endpoint assessment. The main inclusion criterion was limb weakness and an NIHSS score of at or above 3 or aphasia. The main exclusion criteria were presence of intracranial hemorrhage or signs indicative of large infarct size on non-contrast CT. Outcomes were assessed by centralized telephone interviews after 90 days of follow-up. The primary efficacy outcome was functional status assessed by ordinal shift analysis across the full distribution of the modified Rankin scale, and with excellent outcome defined as MRS 0 to 1 as a secondary efficacy outcome. This table shows the baseline characteristics in the 288 patients who were treated with Tenecteplase and the 290 patients allocated to control. The groups were balanced with regards to age and sex, pre-stroke MRS, NIHSS on admission, and time from wake-up to randomization. But the proportion of patients who were treated with thrombectomy was higher in the control group compared to the Tenecteplase group. This figure shows the distribution of MRS scores in the two treatment groups. 45% of those in the Tenecteplase group and 38% in the control group attained an MRS score of 0 to 1. Although the efficacy estimates are in favor of Tenecteplase, and most so for the excellent functional outcome, there was no significant difference between the treatment groups, neither when assessed by ordinal shift analysis across the full range of MRS scores, or for the MRS 0 to 1 outcome. There was no significant difference between groups with regards to the risk of death. The risk estimates for symptomatic intracranial hemorrhage were higher in patients treated with Tenecteplase than in controls. However, this was not significant. In light of the actual observed treatment effects, it's clear that the estimated treatment effects was too optimistic and that the trial as a consequence was underpowered. This limits the interpretation of the results, both with regards to efficacy and safety. The unbalanced distribution between the treatment groups with regards to thrombectomy may also have affected the results. To summarize, treatment with Tenecteplase did not improve functional outcome scores at 90 days of follow-up in patients with wake-up stroke selected by non-contrast CT. Treatment with Tenecteplase resulted in a higher proportion with excellent outcome compared to controls, but this was not significant. The frequency of symptomatic intracranial hemorrhage was higher in the Tenecteplase group than in controls. Thank you for your attention.